Have you ever been told to lose weight before a doctor even examined you? Yeah, me too. But what if I told you that focusing on weight first can actually delay the care we need and in some cases cost lives? Hi, my name is Tamisha Campbell, founder of Enhance Black Women's Health. My mission is to equip you with the tools to support Black women's health through tailored nutrition and lifestyle strategies, without the shame, the assumptions, or one-size-fits-all solutions. And today we're going to be talking about weight stigma in healthcare and how the obsession with weight, especially obesity, can lead to misdiagnosis, mistreatment, and missed opportunities for care. And I'm going to share real examples, including one case study that has stayed with me for years, and my own story navigating bias as a patient. Now, if you're a healthcare provider, a wellness coach, or just someone trying to make sense of your own experience, this video is for you. Now let's talk about what gets missed when weight takes the spotlight. Myth number one, health is solely determined by weight. We hear this a lot, but it's simply not true. Weight is not a complete indicator of health. It leaves out crucial factors like genetics, access to care, cultural foods, and chronic stress. One heartbreaking example of this comes from a 2020 case study where a 54-year-old woman was diagnosed with monstrous obesity, but what she actually had was a 46-kilo cancerous mass growing in her abdomen. Instead of being properly examined, she was referred to diet programs. Her pain and her very real symptoms were brushed off because of her size. Myth number two, weight loss is the answer to all health concerns. When clients in larger bodies seek care, too many are told just lose weight. That same patient we talked about earlier told her healthcare team about her abdominal pain and her unexplained weight gain. But because they only saw her weight, they didn't look any further, delaying her diagnosis by over a year. That's not just frustrating, it's dangerous. And I get it because something similar happened to me. Years before I was diagnosed with rheumatoid arthritis and Sjogren's syndrome, I went to my doctor with my symptoms. Instead of investigating, she told me to focus on weight loss because of my high BMI. 3 years later, I finally got the answers, but it shouldn't have taken that long. And myth number three, weight is solely the result of individual choices. This myth keeps blame on individual and ignores the full picture. In the case study, the patient's weight gain wasn't from overeating, it was from a tumor. No matter how closely she followed the nutrition plan, it wouldn't have addressed the root issue. Weight isn't a behavior, it's not a moral failure, and it's definitely not a diagnosis. So what does this all mean? Weight stigma delays real care. It causes providers to overlook or dismiss symptoms that deserve investigation, and Black women are especially at risk. Cultural bias, medical racism, and size discrimination intersects, leaving too many without proper support. And guess what? There are better ways forward. 1. Offer care that's culturally relevant and respects body autonomy. 2. Address access to nutrition without shame or assumptions. 3. Equip clients with tools, not blame, to make decisions that work for their lives. If this message resonates with you, whether you are a patient, a provider, or a coach, I invite you to join me in creating a new standard of care. Subscribe to the Enhance Black Women's Health YouTube channel for more videos on weight-inclusive care, culturally grounded nutrition, and strategies that center real-life healing. And drop a comment and let me know, have you ever experienced weight stigma in healthcare? Together, we're building a more just and affirming approach to health, one video at a time. See you next time.